So now if you're a higher risk, the zinc, you can bump that up to 100 milligrams. He still has vitamin C at 1,000. I have it at 2,000 milligrams daily. Here up his vitamin D3. I agree, 50,000 units. I would do that until people are feeling better. Because really the pandemic, folks, is lack of vitamin D. Even in my colleagues in the Philippines, they don't get the sun exposure because they got indoor jobs. And the pandemic has caused them to be more isolated. And so vitamin D is huge. And so we should be taking it daily in the winter months in the northern plains. Most people need to take it all year round because they just don't get the sun exposure. And then the last two are antibiotics, azithromycin and doxycycline. And I did take the azithromycin for a couple, I think it was 3 days I took it when I had the COVID. And that's an option too. And that's depending on fever, cough, productive cough, if it sounds like you might have pneumonia. These two medications, there's a lot of controversy. I'm one of the frontline doctors who believes the benefits outweigh the risks, taking hydroxychloroquine and ivermectin. And I've prescribed it to many people, the ivermectin, in the last couple years. And thank God, by His grace, none of them had to go to the hospital. And so I prescribe 0.5 milligram per kilogram per day for 5 days. And I would not be opposed to adding hydroxychloroquine, 200 milligrams twice a day, with that or in lieu of. I believe ivermectin has a safer profile. Hydroxychloroquine, especially with people who have heart problems, it can prolong the QT interval. And so ivermectin is just a safer drug. And I've had a lot of use with that when I on my mission trips to Guatemala, using it for parasites and scabies.